Your name?
My name is Herbert Goldman. I'm a physician in the Caribbean, formerly in Puerto Rico, currently in the Virgin Islands.
Which island?
St. Thomas.
What's your practice?
Hematology, oncology.
What brings you to Washington, D.C.?
The single payer rally.
Why do you favor single payer?
Well, because it covers everybody. It cuts out an enormous amount of bureaucratic waste, including the 25% that the health care intermediaries, the insurance companies and the HMOs take out of the health care resources for their overhead and profit. And
well, if it's such a good deal, why isn't it happening?
well, it isn't happening primarily because of the clout of the intermediaries, the insurance companies, the HMOs, who are the largest healthcare contributors, largest contributors to the legislators of any group. And currently, the Democrats are receiving even a larger share than the Republicans.
So we interviewed Dr. Marcia Goldman, former editor of the New England Journal of Medicine, and she just flat out predicted single payer is not going to happen because of exactly what you said. The powerful insurance companies won't let it happen. Do you agree with that?
Well, I think, that they have a lot of clout, but, revolutions happen, and revolution in healthcare may well happen because things are going so badly.
What made you a revolutionary?
Well, I've always been kind of a backbencher, somebody who's not in the forefront, and a little bit willing to step out from the usual lines of thought. And I think this is a no-brainer.
Well, doctors tend to be conservative people, yet there are recent studies showing that most doctors now favor single payer. How can that be that conservative people favor single payer?
Well, my experience is that billing has become so difficult that the average doctor has more people doing billing than helping them take care of patients. It's gotten to that point that the inefficiencies, the dissatisfactions among the doctors, not all doctors are there to be businessmen. Some of us want to take care of patients. And even if we make as much or almost as much money hiring 3 times as many people to do the job as is needed, some people will be happy with that. They say, don't rock the boat. But the system is so inefficient and it's heading over a cliff.
So, finally, is single payer going to happen? And if so, when?
Well, I don't know. Everybody goes back to Winston Churchill, who says that Americans always do the right thing after they've tried everything else. So that's a possibility. But there's so much propaganda against single payer, so much misinformation. For example, they say that the public option, not even single payer, but offering a government health plan in competition to the private companies would be too much competition. Don't these people like competition? Isn't that what they live for? That to say that competition will make things right?
But Dr. Angel and others who are single payer advocates saying public plan won't work because unless you have everybody in, nobody out, you still have the intermediary costs and it will sink the system. There'll be cherry picking and so forth. Do you agree with that?
Absolutely. It's a real risk that all the terribly sick patients will go into the public option. And certainly the bureaucratic costs are enormous. Even our Medicare is much more bureaucratic than the Medicare, for example, in Canada. But you know, the conservatives say, look at Canada. Their waiting lists for knee replacements, hip replacements. We don't want that. But what are they comparing it to? They're comparing Canadian Medicare with our Medicare, and if they're saying that Canadian Medicare is not as good, they're saying that ours is better. We want our Medicare for all. That's what we're asking for. You know, and then they say, you know, Great Britain doesn't cover things that are effective but cost too much. They think that's terrible. Well, I don't know if that's so terrible. If you have a treatment that will add 1 month to somebody's life, but cost $1 million, and that's the way things are headed nowadays with the drug companies, I don't think that that's an option. But in any case, once again, they're comparing the national health system of Great Britain with our Medicare. They're saying our Medicare is good. You know, it's a dishonest argument.
Thank you, Doctor.